Hello, this is a video demonstration of the use of the HEX pupil expansion device in a case of a uveitic cataract with posterior synechiae. The first step would be to ensure a complete synechiolisis after staining the capsule. It is important that we make sure that any broad posterior synechiae that may be present also be separated. Once this is done, we are ready to insert the HEX pupil expansion device. The HEX ring has to be inserted completely in the anterior chamber with the help of the HEX forceps. A dispersive viscoelastic would be a preferable choice in these cases. The alternate flanges, as described, have to be tucked under the iris. Specifically for such cases of uveitic cataract, it would be a good idea to avoid tucking the flanges under the atrophic iris. So you choose a part of the iris which has got substantial thickness rather than the rim which is atrophic, as you can see here. Fixating the globe is a necessary tip while inserting the flanges. Sometimes the adjacent flange may also go under the iris, in which case it has to be removed out. As you can see, thanks to the ring, we can do a large and well-centered capsulorhexis. While doing the hydrodissection, it is necessary to be gentle and also intermittently decompress the back by tapping on the opposite end. Otherwise, it can dislodge the ring. When you are doing cases like this with the ring in place, it would be a good suggestion to first finish chopping all the pieces, either by the 4-quadrant or by the direct chop technique, and then start emulsifying the pieces, preferably if you can with the one-handed technique. As it is evident, the ring ensures a complete and safe cortical removal and even posterior capsular polishing, which wouldn't be possible in case the pupil was smaller. While inserting the intraocular lens, it would be a suggestion that we may flex the haptic into the bag rather than dial it in, because sometimes it may pull along the subincisional flange of the HEX ring. So we have to avoid that. Once it is in the bag, we can dislodge the alternate flanges either with the push-pull hook or with the HEX forceps again. If there is too much iris prolapsing at the wound, we may even remove this ring through the side port. Make sure that you keep filling viscoelastic at regular intervals. And while removing the ring, we have to be sure that the iris is not tucked in any part of the ring. Otherwise, it can cause a bad iridodialysis while removing the ring. So I guess this makes a very difficult cataract look very simple. And I think I must thank Dr. Suven Bhattacharya for inventing this very useful and not so expensive device.